Intergraded. Yeah, feel that.
Yeah.
So this is the perfect way to assess this. You can get to her left. Of course, her right, she's on right now, but you can assess this trochanter so nicely.
And then her heels, for sure. And is there anywhere else on her feet that I need to be worried about?
No, but how did you get this bruise, honey?
It's not a bruise. I don't know. It's on my legs.
And it doesn't hurt? Because it looks like it's a hematoma.
I don't know.
No, that's fine, as long as it's you and it's okay. Did we talk about capillary refill?
Yep. No,
Okay.
not yet.
Okay.
No, but we've talked about it.
Okay, so that's something on your cheat sheet too that you'd look at and say, I didn't do capillary refill. Her nails are not polished, so we could do her nails, or we could do the tips if they were the tips of her thumb.
Okay.
So her toenails are, so we can just do the tips of, see that
Yeah.
instant, it's
Yeah.
awesome. Yeah, awesome. So that's all we do posteriorly. I mean, that goes really fast. It's the majority of the work is anterior, then you flip them to their side, because that's how they're gonna be when you get there early next semester. I'd like to talk just a little bit about the write-up because it's worth 20 points. So if you have that, that form out of Blackboard, I'm thinking the subjective form.
Yeah.
Okay, if you look at that form, all you have to do with that is just fill in the form. So you're gonna ask your patient all these questions. If your patient in real life, a fellow classmate, is on Prozac, if not, they're on oral contraceptives, if they're on a medication to suppress herpes, we don't need to know that. That's none of our business. I'm glad that they're on their medications to help them, but please don't disclose that information. Just say none if you want. As you fill that in and look at that form, some things are not maybe going to apply, but the majority will. If it's a question you'd only ask a girl, like when's your last menstrual period, fill it in. If you have a male partner, that one question is going to be NA or not applicable. Everything else pretty much is applicable, so glucose screening, lipid screening, anything on that form, it'd be good to know and to ask.
Whenever, like, the vaccines and stuff, if they don't know, what do you say? You just say, like, up to date?
And I would hope that you would know to say, we've not really talked about it much, but you should have a tetanus that is up to date, because you know that you've had to have one, and you should know that you need an annual flu vaccine.
But what do you put there? Do you just put up to date?
No, because I'm not for sure, so if they don't know, I will write record not assessed or not evaluated. Because I don't want to say up to date if they're not,
Yeah.
you know.
Yeah.
So this is all we turn in?
That is all you turn in for subjective. And as you look at that form, if any questions pop up on that subjective form, just let me know. Yes.
So the safety belt, you asked them if they were asleep while in vehicles?
You bet. Because that's the #1 reason people your age die. Yeah, really important. And it's top 10 for about any age categories car accident. So let's pretend we're going to turn in our write-up now. If you look at that integrated write-up sheet, and I know you can't see this, but this is out of Blackboard. If you look at that sheet, it starts out with a general description. So you would just write that major topic, general description. And the first thing underneath there that you would want to note is level of consciousness. So I would write that our patient, and we can really ask her where she was today. So she can say, I'm in the basement of the HP building, and this is April the 5th, this is morning time, or even if she could tell me that it's the first week of April, it's Easter week, whatever she wants to say. I'm thinking she's alert and oriented. She could tell us her name, we checked her name at time screen. So to person, place, and date. The next thing on your list is posture. You could record that she was supine and comfortable. Obvious deformities, none. Just that easy. Mood and affect appropriate. for situation or just appropriate. Speech is clear. Hygiene was adequate, or you could say good. And then the next category that you would want to make a header for is measurement. And then you would list her weight, her height, her blood pressure on both right and left, and her pulse. Then you would talk about the color of her skin, and I would say underlying pink tones. And I would say the texture, the turgor was elastic. You could say some pertinent negatives, like she wasn't diaphoretic. You could say in there, I hope you would say that there was no edema. And then move on down to HENT and make another header. And so when you turn this in, it's just that quick and it's just that short. But organization by headings. Questions about that?
Is that, it says integrated write-up due before the end of the lab on the same day as integrated checkoff, so we're just writing this, hand writing.
Yeah, it'll be a lined sheet of paper.
Okay.
And you'll just staple the subjective fill in the blank. You don't need to write all that out. Just staple it to whatever your objective findings were.
Okay.
Yes.
So are those like general description and measurement, is that considered level 1 or level 2? Or does it really matter?
Oh, for APA. Does
Just
not matter.
handwriting, just
Doesn't, it's just like charting in real life.
Oh, okay.
Yeah, so, but thanks. No, this is no APA. Just make sure you have your name on it
Okay.
and that it's legible, but there's no poison here, so we should be okay.
Oh, you haven't seen my handwriting.
I'm sure we'll be okay. I really think so. And Melody is, yeah, she's way back. She'll be fine.
So, do we do this objective in front of you guys too? Okay.
No, and some people are not gonna be scheduled until like 20 till 11. So I would go ahead and do my write-up. I'd go ahead and do my exam, do my write-up, and then just come in at 20 till 11 and demonstrate and you're done. So you don't have to stay to do your write-up. You're done when you should be done. And we normally just do that alphabetically.
Oh, great.
Sorry. That's not a good thing.
Who's gonna watch us?
It usually is your clinical instructor, but I'll take a group too. So I'll divide them, instead of in 4s, we'll be divided into 5 groups. So some people might have to be with somebody they're not used to.
So you think we'll go past 10:50?
No, and no, it's our goal, because some of you guys have class,
And like I gotta work and stuff.
and some people work, and no, we can't keep
Okay.
you past class time.
You can count me off now.
Pretty much so.
Okay.
I'm not kidding, you did a great job, you did a great job. But you can look at your cheat sheet, I don't want you to feel intimidated by this. Next, or when we go out the next weekend to clinical, you'll have your cheat sheet with you.
So next week is clinical, we go to
The very last week of lab is clinical, yeah.
And we do this on patient.
We'll also do a breast exam, so hopefully they'll accept a breast exam, whether it's male or female.
Okay.
But, you know, they can decline. if
Are
they
we in
want.
partners or by ourselves?
Probably by yourself, because next semester, you'll start out pretty quickly. I mean, by yourself taking at least one, and by the end of this semester, most instructors have you guys taking at least 2 patients on your own. And by the time you're seniors, you've got the whole floor you're in charge of. And then in practicum, you know, you're taking a regular nurse's load the last 8 weeks of the program.